surgery scheduled in the coming days, weeks, or months, there's one important stop you need to make before you go under the knife, and that's to the physical therapist. I'm at Activcare Physical Therapy talking with physical therapist Jessie Kuykendall about why it's important to see a physical therapist before you have surgery, and that can really help strengthen you, can it?
Absolutely. Actually, research has shown that coming to therapy prior to surgery can help strengthen your post-surgical outcomes, including a faster recovery time. So it is a great opportunity not only to strengthen the tissues before surgery and increase the range of motion before you go under the knife, but maintain those gains after surgery as well.
Are there any particular types of surgery that this is a good idea for, or does it matter at all?
Oftentimes we will see pre-operative rehab for an individual that may be undergoing a knee replacement or shoulder reconstruction, and sometimes ACL injury is actually a really big area we see.
How much of a workout would someone need to go under before they go for surgery?
Oftentimes what we'll do is it's gentle strengthening. Obviously a patient is in pain if they're about to go under surgery, so it's trying to gently strengthen the tissues without causing further damage, but mostly maximize range of motion prior to surgery.
It really helps to alleviate some of the fears too, doesn't it?
Absolutely. It gives a patient an opportunity to meet with a therapist that will be providing their post-operative care and kind of have an opportunity to ask any questions they have regarding surgery, get a feel for what they're going to undergo in the hospital once they're home, and that a lot of times can help kind of calm a patient's nerves before their first big surgery.
And also the patient can get some instructions too on things that they can do at home to help them out before they go into surgery.
Absolutely. A lot of times it is beneficial to have that instruction prior to the procedure. What type of car, for example, might be most beneficial to be picked up in after your procedure, things that you may want to purchase for the home to make your stay a little bit more comfortable, and a lot of instruction regarding anti-inflammatory control, regarding icing procedures, elevation, compression, all of the things that are important after a big procedure.
Okay, let's talk about after the surgery, post-operative therapy. What kinds of things should a patient expect to go through?
Well, oftentimes we'll do a lot of gait training if it is a surgery that involves lower extremities, so we will be teaching things like crutch training on stairs. Negotiating stairs with crutches can be difficult unless you've been properly instructed. Getting into and out of a car after surgery, and then the biggest thing we'll be working on is just slowly strengthening that tissue in a gentle way following a surgical guideline so that we don't damage that newly constructed tissue.
Post-operative therapy is also a great time for the patient and the physical therapist to talk about a timeline for recovery, right?
Absolutely. Oftentimes the plan of care will be centralized on the healing process itself. We're working with tissue that is undergoing a healing process that is kind of on its own clock, so we have to just be careful to keep that tissue safe and strengthen it as the body's natural process of healing allows. And we'll usually discharge therapy once the patient is able to achieve that full level of preoperative function after the healing process.
So it sounds like preparing with this preoperative therapy as well as the postoperative really can help the repair and the recovery to move along faster and in a better way.
It's really a holistic approach that allows us to maximize patient outcomes.
Fantastic. Jessica, thank you so much.
Not a problem.
Be sure to give Activcare Physical Therapy a call or check them out online. There's locations throughout the Triangle as well as in Fayetteville. ActiveCarePT.com.